And we can do that by following our non-pharmaceutical interventions. And that means not drugs, not immunizations, but just keeping your distance from people, wearing a mask, avoiding gatherings, choosing outside versus inside, preferentially. I also want to mention something that came through this morning in my email, and that was an update on the variants in our county. But previously, couple 3 weeks ago, reported that there was a UK variant that we documented in the county. This report said that there were 45 UK variants in the county, that there was one South African variant, and that there are 7 of the Brazilian variants. We're concerned about these variants because they spread more easily, because they can cause more serious disease. They can recur, especially the Brazilian variant, after you've previously been infected with the natural COVID virus. But as it turns out, not so much after the vaccination, we're believing. In fact, we believe the immunity you get from vaccination is better than the immunity that you get from the disease itself. But the good news about the presence of these variants is that they constitute only 1 to 2% of the positive tests for COVID in our county. We're still at 1 to 2%. We can keep it at that number. We want to keep it at that number. How are variants created and how does that number grow? It's simple. By having more and more cases, more and more opportunities for it to grow, more and more opportunities for new variants to arise. So if we keep doing the things we're doing, we're going to keep that from happening here. The other thing that will help us is increasing our vaccination rates. We're at about 35% of the people in our county who can receive this vaccine have now been vaccinated. And it looks like in the next few weeks we're going to be getting more and more vaccine. So that combination of the two things, increasing doses of vaccination, increasing numbers of people vaccinated, low amounts of the virus in our county, means it's relatively safe from COVID in our county right now, but we've got to continue to do those non-pharmaceutical interventions. I also want to touch for just a moment on the 4th vaccine that's in the offing, the AstraZeneca vaccine. It's an English-Swedish company. It may be available in the United States if all goes according to plan by the end of April. It's inexpensive, it's easy to store, it can be kept for 6 months in the refrigerator. Like 2 of the 3 vaccines we already have, it takes 2 doses to achieve full and lasting immunity. And it does the same kind of thing by asking the body to create antibody to the spike protein, which is the part of the virus that attaches to human host cells in your nose, your throat, your lungs. In this, there are concerns with the vaccine that were raised in Europe. After 17 million people there in Europe were vaccinated, 37 people were reported to have blood clots. 22 of those were in the lungs, pulmonary emboli. 15 were in veins, in the legs, deep vein thromboses. But during a year in Europe, there are 340, I looked at 6 of the more populous countries, there were 340 million people in those countries. 761,000 clots were reported. So that means 0.2% of the general population had those clots just in normal times, every year. In the vaccinated population, it was 0.18%, the same, in fact, slightly less. And so the World Health Organization and the European Medicines Agency looked at this. The first country closed down on giving these vaccines March 11th. But after it was reviewed by these 2 organizations, World Health Organization, everything opened back up again, even other countries that had closed down, by March 19th. The data, they said, these organizations, does not suggest the vaccine caused clots. The rate of post-vaccination blood clots was actually lower than the expected rate in the general population. And so in terms of safety, we think this is a good, solid vaccine. So how many doses will be available? Well, it might not be available until the end of April, but at the beginning of April, the company says they're going to have 30 million doses available for the United States. And that translates to about 60,000 doses for Ventura County. And that's just the first release of the vaccine. There were, the company pointed out in a press release, 79% effective in preventing any symptoms at all by people who were exposed to the virus that received this vaccine. There were, like the other 3 vaccines, no hospitalizations. This one says, and no severe disease, and no deaths. So we're also planning on giving some of this to our neighbors, Mexico and Canada, and that's a good investment because it keeps the virus from coming in to our county, to our country. But there is a sobering observation, and that is the National Institute of Allergy and Infectious Disease points out that they're concerned that the 79% figure is not exactly correct. They feel that the most recent month of data was not included in the company's calculations, and that might lower the efficacy rate from 60 to 69% or 75%. So, on the other hand, I'm an optimistic person. I think 65% of people who receive a vaccine that get no disease whatsoever, no symptoms whatsoever, is still pretty good. But what I'm really happy about is that we have an organization that is an honest watchdog, that is saying, wait a second, let's not just rush enthusiastically into another vaccine. Let's really weigh this. Let's really be certain that it's safe. And so the company's recalculating its figures. They're supposed to have more data out by tomorrow. So we'll stand by and we'll watch and we'll see how things turn out for the approval of this vaccine. But it is being scrutinized, and that's the good news. And I think the last thing I want to touch on is that I hear a lot from parents that they want their kids to go back to school. I think teachers are undervalued, they're underpaid, they're underappreciated, and I think we all need to remind ourselves to cherish, to care for our teachers. On the other hand, we have an ask for our teachers as well, and that is, you've wanted to be vaccinated. The CDC has said teachers can return even without vaccination, but our teachers across the state have wanted to be vaccinated, and we have vaccinated them. Now we're hearing, and some parents are very upset about this, and I don't blame them. I don't blame them at all, that some schools plan on not opening until the fall. I think that we should expect more of our teachers. Many teachers have returned. Many teachers have, but there are those that are holding out, and we just want to encourage them to return to the classroom as well. The students are ready to return. So those are my comments. I'd like to introduce now the Director of Maternal Child Health Fellowship, Dr. Lisa Solinas. She also has practiced here in Santa Paula for 23 years, has delivered many of you who are listening to this because she has dedicated herself to delivering children. So she'll be with you as soon as I finish cleaning up here. All right. Thank you.
Good afternoon. My name is Lisa Solinas, and I have been hang on one second. All right, I guess that's good. I have been practicing as a physician here in Santa Paula for approximately 22 years. Happily, it's been a joy most of the time. And I'm really happy to be here today to both promote healthcare services in the Santa Clara Valley and maybe to address some of the things that I've been hearing from my patients and from other community members. First of all, I thought I'd start with a story. About 2 years ago, I heard that the OB unit at Santa Paula Hospital was going to close. So it was hard for me. I thought long and hard about it, and I considered leaving. And I got really close to leaving and going to another hospital. But when I heard that the hospital was going to open its OB unit again, and I got a call from Dr. John Fankhauser saying, would you reconsider? We're going to open the OB unit after all. I said, well, this is my first love, and I really love this community. I really want to be doing this. So I came back, and I'm not sorry I did. It's been a pleasure to be back working. Not that I was gone for any length of time, but it's just been a pleasure to be doing what I love doing. And so that story, that's just the beginning of the story, because the end of the story and the ongoing story is that as, you know, I've been here now for 22 years, I actually I'm getting to see some of the patients of the children of my patients having their babies. I walked into one of our labor and delivery suites right before the pandemic started, actually, and I realized when I walked into the room that the patient was actually somebody who I'd actually delivered 20 years ago, and her mother, who I knew quite well, and her mother's mother, who I've taken care of for many years, were all in that room, and it just warmed my heart. It was just such a great feeling. And that's really what's so special about working in this community. It's a small community. The Santa Paula Hospital is a small hospital, but it has so much about it that's special. The things that I really cherish about the hospital are that being a small community hospital, it really feels like you're in Beverly Hills. You're just treated like you're special, and like you're one of the richest people in the world when you walk into that hospital. And yet, even though it's a small hospital, it offers essentially all the services that a bigger hospital offers. There are a few things that we don't have, like we don't have a neonatal intensive care unit, but we do have pediatricians, and we have all of the pediatric surgeons that do surgeries at our hospital. And we have our staff, our nursing staff, and our physician staff are such top quality that you'd find them at any big hospital in the LA area or anywhere else in this country. So just to put in a little plug for what a great place it is to be, and how important it is to the community. And I think that's really the reason why the hospital stayed open, is because the community does really, really value this hospital and the services that we provide. So I did want to, since we're talking about COVID and Dr. Levin did such a great job of bringing us up to date, I wanted to just address one of the questions that I've had a number of times over the past couple of weeks in particular, and particularly in this past couple of weeks because the CDC and WHO have now designated pregnant women as people of high risk, and have decided that they should receive the COVID-19 vaccine. So I'm getting lots of questions from my pregnant patients. Should we get the vaccine? Is it safe? And what I would like to just say as part of my final comments is, I've been telling everybody that we think it's safe. We don't have all of the data that we wish we had, because the initial studies didn't include pregnant women, but we're getting there. They're currently involved in doing studies on pregnant women, and most of the retrospective data that we have now is about 9 months old. We have 9 months worth of plenty of doctors and nurses who are pregnant who have gotten the vaccine, and there have been no problems with it. And beyond that, I have taken care of lots of pregnant women who have gotten the illness, And there is no question that there are risks for pregnant women. I've had patients who have had to be ventilated in the ICU. I've had patients who have gotten tremendously ill and have had to have their babies delivered early, and the babies have had to go to the NICU, the NICU. So they're really, when you balance the risk of getting the illness with the theoreticals of getting a vaccine that hasn't been completely studied, I think there's no question I would absolutely, if I were pregnant, I'd get it. If my daughter were pregnant, I would tell her to get it. And beyond that, it may even be protective for women who are breastfeeding as they pass antibodies onto their breastfeeding newborns. So there's my little plug for getting the vaccine. And I thank you very much for inviting me today. I'd like to introduce the next speaker. Dr. Minako Watabe is the director of, I'm going to get this right, the associate director of both medical office. She's associate CMO and associate director of Women's Health Services for all of Ventura County. Thank you.
Hi, thank you so much. And I feel very honored to be introduced by Dr. Solinas. I think she probably knows me as her patient, because about 9 years ago when I became pregnant with my first daughter, Dr. Solinas took care of me. And 9 months later, my daughter decided to be breech, and so she and Dr. Kelly delivered my first baby at Santa Paula Hospital. And it sure must have gone well, because 14 months later, I was back at Santa Paula Hospital with the same team, same place, having my second daughter. So Dr. Solinas and the hospital are very near and dear to my heart. So thank you for the introduction. To all the community members here in Santa Paula and Fillmore and Piru, thank you so much for joining us. I'm really honored to be talking to you as we see the light at the end of the tunnel during this pandemic, right as we're entering spring, which I really feel like is very appropriate. As a mom, as a physician, as a community member, I just feel so encouraged by the strength of our community and enduring all of the challenges and uncertainty of the past year. It's certainly been uplifting to see the reduction in COVID cases and seeing less people suffering in our hospitals. This community was hit so hard, but thanks to all of your great work in supporting each other and practicing the safety measures, and of course getting vaccinated, we're in such a better place today than we were a few months ago. I wanted to take an opportunity to share a few highlights about Santa Paula Hospital and where we are today. As many of you know, Santa Paula Hospital in the past months took care of so many patients who were suffering from serious illness from COVID. Thanks to all of your great work, we've reduced the numbers substantially, and Santa Paula Hospital now has so much of a higher capacity to take care of all of our community. Our emergency rooms are open to anyone requiring any sort of urgent medical care, so please don't hesitate to come. Actually, a good friend of mine just this past Sunday, she was having belly pain and she drove herself to Santa Paula Hospital. And within minutes of entering the hospital, she was brought to the back and seen by the emergency room doctor who identified that she has appendicitis. They called the surgeon, Dr. Blickenstaff, who brought her to surgery. And by the time I called her back, seeing her text message that, oh, I have appendicitis, I called her back. She goes, oh, I'm already at home. I'm recovering from surgery and I feel so much better. And I have to say, she couldn't stop talking about how happy she was with the care that she got, how quickly she was able to have her surgery, and how caring everybody was around her. Many of the staff members remembered her from when she took her mom there when her mom was ill. So all of the community members within the hospital really treated her well. And honestly, it's these stories that really make me feel so honored and special for working at Santa Paula Hospital and being part of the staff. And then speaking of surgeries, I just wanted to mention that because of the improvement in our status with COVID, that we're able to perform all essential surgeries now at our hospital. I know just from speaking with community members and my patients that many of you have waited for months, maybe even a year, to have surgery for maybe a gallbladder that bothers you every time you eat, or thyroid surgery, or breast reconstruction after having a mastectomy for breast cancer, for surgeries that help with incontinence, which certainly wasn't life-threatening and didn't meet the criteria, but really impacts quality of life and really could be improved with surgery. We can do surgeries for fibroids, ovarian cysts, or kids who need their tonsils out because they've been struggling with their tonsils. All of these surgeries we're now able to do without straining the medical system. So we're really happy to be able to provide these services again. So if you've been waiting for surgery, if you're out there in the community, please reach out to your doctors, please reach out to your surgeon, and just let them know you're waiting so that we can take care of you. As you heard from Dr. Solinas, our OB services are as strong as ever. Dr. Solinas is as busy as ever, along with our midwives now in our in-hospital birthing center. In fact, Jody, our midwife, delivered a little baby this morning. I just stopped by to say hello. So we're all here taking care of expecting mothers. We did that through the pandemic, and we continue to do so even now. I also just wanted to mention something that I think is really important for our patients is that because of the improvement in numbers, we're now able to allow visitors into the hospital to be with their loved ones during really difficult times. I know that during COVID, over the past year, it's been really hard for a lot of our patients who have been suffering from illness and not being able to have a loved one at their side. We've been able to allow, partners of laboring moms and parents of children, support people for people with disabilities, but haven't been able to allow visitors for all of our patients. And we're at a place now where we can do that. So we're just happy to be able to allow the visitors in and to provide comfort for our patients in the hospital. So please know that from the medical community and all of us at Santa Paula Hospital and Ventura County Medical Center that we're so grateful to the community for all of your support during this incredibly, incredibly difficult year. Everyone sacrificed so much and worked so hard to get us to this point in the pandemic, and we can actually look forward to a summer. I know I'm looking forward to a summer where my kids, to the spring where my kids hopefully will go to school, summer where they can be outside and play, with their friends with safety precautions, but more freely than last summer, and going back to some form of normalcy and enjoying another beautiful summer in Southern California. So with that, I will introduce the man who needs no introduction, Mr. Mike Powers, our county CEO.
There we go. All right, well, thank you so much, Dr. Watabe. Good afternoon, Ventura County community. It is beautiful to be here in the wonderful city of Santa Paula. And there seems to be a theme developing with deliveries at Santa Paula Hospital. So I will continue that theme and just reminisce at how my oldest son, Charlie, was born there about 12 years ago. And we had an amazing experience. I recommend it to everybody. And Charlie is very proud that he was born at the reopened Santa Paula Hospital. And to hear Dr. Solinas and Dr. Watabe talk, it's just a great reminder of it's amazing to have a community rural hospital like this with the quality of physicians that we have there. The care there is second to none, and it's because of people like these wonderful doctors there. So we're so fortunate to have them here in our community, and we're so fortunate that the community here really supports their Santa Paula Hospital, your Santa Paula Hospital. It's also great to be here in this site here at the former, at the former Kmart here in Santa Paula. I think it's a good reflection of the fact that this is a big site with big capacity. Now you can see it's moving at a fairly deliberate pace here, not super fast. That's because of supply from the state. It's not where we need it to be yet. But the good news is we've committed to you that we want our capacity to exceed our supply, and you can see that here. And that's good too, because in about 2 weeks, we're going to start to see that supply ramp up, and we will be ready for it. Because that's our pledge to you, is that when we get the vaccine, we'll give it. And so this is just another great example of it. We're excited to see it. It's a perfect location. It's set up here. You're going to have a great experience when you come. It's really efficient. It's well organized, and the people here are super nice. Also want to let folks know in the Santa Clara Valley that there are health centers here that we have as well. Our county healthcare clinics in Santa Paula, in Fillmore, as well as health centers with Clínicas del Camino Real in both Santa Paula and Fillmore, and all of those clinics are administering vaccines to their patients there as well. So a lot of great things going out here in the Santa Clara Valley. From a countywide standpoint, we've heard some really good numbers lately, and it is exciting to hear from our public health leadership that because of the work that you're doing, we are heading towards orange. And if we stay on the trend that we're at, as early as April 6th on Tuesday, we could move into the orange tier. And so that's very exciting to even say. And even more than that, just today, we learned that one of our metrics, the overall positivity metric, is at 1.9%. That's actually in the yellow tier. So it's almost too exciting to think about, but it just shows that we are heading in the right direction here in Ventura County because of you. There are many support programs, as you heard Supervisor Long set out for you. Also want to highlight with respect to the business assistance programs, there are webinars being offered in English and Spanish for that at the website vcbusinessgrants.org, vcbusinessgrants.org. And the registration for the grants just opened today. And already, we're just reporting the latest data, we already had 3,000 views and 260 businesses have registered to apply. The window to apply opens March 31st. So please, we really urge our wonderful local businesses to apply if you haven't already. In terms of the vaccines, vaccination sites, we are converting many of our large sites to My Turn, the state site, this week, today, and the next few days. So we'll be working through that with you and continuing to message as we go forward. Those sites are located on vcrecovers.org, as you well know. And lastly, just testing. You know, it continues to be so important. You know, for a while we had really high numbers in terms of case spread, and people thought, oh, what's happening? Well, I think a lot of that was because the community, were getting tested. So we had a better picture of what our actual community spread here was in our county than in most other counties in the state. And we hope that because of that, maybe we would drop faster because of the good testing and isolating and following the guidelines that you were doing. And sure enough, that's what's happened. Our numbers are dropping here in Ventura County at a faster rate than they are statewide. And that's a reflection of the work that you're doing. So with that, Ventura County would just say thank you. Because of you, we're heading in a great direction here in the county, and we'll just try to keep that momentum going along with you. So thank you, and take care.